Diabetologie-online ist auf der 13. Internationalen Konferenz für Advanced Technologies and Treatments for Diabetes, kurz ATTD, in Madrid, dem Kongress, auf dem sich Experten unter anderem über neueste Entdeckungen auf dem Gebiet der Diabetes-Technologie austauschen und informieren. Und wir interviewen hier für Sie internationale Experten aus dem Gebiet der Diabetes-Technologie. With me is Professor Dr. Neal Kaufman. He is Chief Medical Officer at Canary Health in Los Angeles, USA. Welcome, Professor Kaufman.
Thank you very much.
In the last 20 years, there were many progresses in diabetes treatment, especially in digital therapeutics. Which is, in your opinion, the most relevant digital therapeutic progress?
The major progress in digital therapeutics has been in taking blood glucose measurement that is available to the patient and to the doctor, allowing the doctor and the patient to talk to each other through digital means rather than have to be face-to-face. It means that a patient is able to see what their blood sugar is, understand better what has impacted that blood sugar, their activity, their diet, their stress, their sickness, whatever might be happening, and then getting expert advice. You can actually expand that into doing that without even having the clinician involved by having artificial intelligence be able to provide that support. With that, people need coaching. And so putting together the ability to measure your blood sugar, to get information through AI about what might be happening, and to have a live person, either synchronized or asynchronously, talking to you has made a profound difference in people's ability to self-manage their disease.
Whom does digital health technology help to treat diabetes? Only patients or also the expert diabetes teams?
It helps both. Diabetes is a team sport. The person themselves is responsible and involved with caring and managing their diabetes without the help of anyone most of the time. They only see the doctor an hour, 2 hours a year compared to the rest of their lives. So patients need support. But they also at times need experts who are able to help them to understand the context, to see what does that high pattern mean after every breakfast or after every lunch? What does it mean when they do various exercise or have a particular diet? So putting that all together means that you help the patient be able to manage his or her condition, but you also help the clinicians be able to provide more expert support in a limited amount of time.
How can digital health technologies help to prevent type 2 diabetes?
Type 2 diabetes is a lifestyle problem. Individuals who are overweight and sedentary, who have improper diets and not enough physical activity with genetic predisposition can go on to get type 2 diabetes. So there are a number of ways that digital health can help prevent type 2 diabetes. For example, in the United States and other parts of the world, there's been a number of programs 20, 30 years ago published that showed that one-on-one support could prevent diabetes. The one in the United States is called the Diabetes Prevention Program, or DPP. Major study was able to demonstrate over a year long, meeting one-on-one, face-to-face, hour a week for 5 or 6 months, and then every other week or every month for the rest of the time, made a huge difference. In 2006, our company built the first ever digital DPP, working with the original creators of the in-person version back at the University of Pittsburgh. A number of companies around the world, in the United States and elsewhere, have continued to do that. So certainly you can put together a comprehensive program that's able to serve hundreds of thousands and someday millions of people where you could never do that in person. There just wouldn't be enough coaches, there wouldn't be enough support, enough resources. But part of the way that digital health can also help within diabetes prevention is people would do better if they track what they do. If you measure something, you can often change that. So what you eat, how active you are, the impact of what your diet is like on gaining weight, how stressed you are, a range of things. And a lot of digital tools are able to do that very easily. You can wear it on your wrist, you can do it in a number of ways. So if you're able to do that while you're getting the support to feel confident that you can overcome the barriers that are keeping you from being active and eating well and managing your stress and having good relationship, you're much more likely to be able to prevent type 2 diabetes. Obviously a very important thing to do.
Which role does social media play in this field?
Social media is really important. Will step back. What social media is a way for peers to interact with peers, to get support, to get help. It has potential for challenges. Sometimes social media can be bullying. You can become obsessed. You can have a range of different challenges by getting too involved. On the other hand, when done well, it can actually make a profound difference. So social media can bring people together. It can help me to see what someone else is going through, just like what I'm going through. It can help people to understand what it is and ways to overcome their barriers. To me, though, the best social media for health-related activities is organized, it's structured, it's got a theory behind how it works, and it allows individuals who are skilled at facilitating groups to provide that. So it's just like as if you're having a support group in the basement of your church, but instead you're doing it online.
Are all these technologies helpful for all types of diabetes patients?
We don't have evidence that they have made outcomes that are substantive in every area. They all have that potential. So, for example, our program that we have is a 6-week peer-to-peer support program that allows individuals and helps them to interact with each other asynchronously as often as they want to, where they're given a certain amount of content. They post a question or a concern that gives them a sense of what problem they may have. A peer answers that concern. They go back and forth all through a digital format. And that can help anyone become more confident. And we know that as you become more confident, you're much more likely to overcome adversity and to be able to do well. So foundationally, that can help anyone. Whether it will work specifically with one population or another is always the challenge. One of the major barriers is some parts of the world, some parts of culture or countries, people don't have access to digital smartphones or to computer approaches. They have other things. They're food insecure and they're worried about their next meal. They're not going to be using a digital program. So I don't think we can expect it's going to work for every person everywhere, but it certainly can make a major difference at a population level because enough people can benefit from it.
Okay, thank you very much, Professor Kaufman.
My pleasure.